Good day, folks. This is Dr. Arvind Kanchi. I am a kidney specialist based in South Bangalore, and I'm going to talk to you today about leg swelling. In medical parlance, we call this leg edema, the common name for swelling in the legs. Patients come to us with swelling in the leg that can be of any duration. It could be about 2 to 3 days, it could be months together. What does this leg swelling mean? Basically, when we look at leg swelling, we think of extra fluid accumulation in the body, and therefore we look at patients in a manner of what is causing this leg swelling, and therefore we think of conditions that are leading to this problem. For example, kidney failure with accumulation of water in the legs can cause leg edema or leg swelling. So the first thing we think of is the patient's kidney working normally, and we do certain tests, which I will come to later. The other thing that the kidney disease could be is a disease process called nephrotic syndrome. This is a disease process where there is a lot of protein leaking from the kidneys into the urine, causing a low protein or a low albumin level in the blood, resulting in leg swelling. This also results in periorbital swelling or swelling around the eyes, and can happen in children as well. This disease process is called nephrotic syndrome. When we think about kidney disease causing swelling, we look at certain test reports called a urine protein test to see how much protein is leaking in the urine, as well as a blood creatinine test to look at whether the kidney function is normal or not. We can do other tests, including an ultrasound scan of the kidneys and so on, to detect what's happening to the kidneys. We'll come back to the kidney disease and leg swelling later, but we will look at other causes of leg swelling. The other causes of leg swelling include the heart. Whenever there is heart failure going on, or let us say a heart attack with a weak pump, that is the heart, or the heart goes into what is called congestive cardiac failure, and this leads to leg swelling. Apart from leg swelling, the patient may also develop breathlessness, breathing problem. He may also say that when he lies down in the bed, he or she may also say when he lies down in the bed, I can't lie down flat, I need more pillows. Or he or she may say, I have to get up suddenly at night and sit up and take deep breaths. This process of symptoms means that there is a heart failure going on. Heart failure, therefore, we will do an ECG, a heart scan called echo, and look at various other tests for the heart to document why there is this degree of heart failure. And the heart failure may be due to a weak heart pump, that is called cardiomyopathy, or a heart attack sort of problem, that is called ischemic heart disease. Now, apart from heart disease, and we talked about kidney disease, both of which can cause leg swelling, there are other causes for leg swelling. The other causes include hypoproteinemia, that is lack of nutrition, where the patient does not take enough protein intake. This can lead to a low serum albumin level in the blood or a low protein level in the blood, and that can lead to leg swelling. Can classically be seen in children as well, where they can develop a disease called kwashiorkor. Apart from this, liver disease can also cause leg swelling. So if a patient has, let us say, chronic liver disease, we call this cirrhosis. The liver is the seat of protein manufacture. When the liver cannot manufacture protein as a result of illness, the protein level in the blood goes down, and this can lead to leg swelling. So this is another cause. Liver function test called a blood test, as well as the liver scan called an ultrasound scan, can be done to look at what is causing this problem and then treat it appropriately. So we talked about the liver, the kidneys, and the heart that could lead to leg swelling. Another cause is chronic obstructive pulmonary disease, leading to a disease process called cor pulmonale. This is a disease process where there is basically a lung problem, a lung disease called COPD, often seen in smokers, and this leads to an extra pressure on the heart, on the right side of the heart. Congestion on the right side of the heart leads to congestion of the liver and leg swelling. Treatment of the lung problem can help resolve this sort of a swelling. Now, apart from this, leg swelling can also be related to local problems. Local problems such as deep vein thrombosis. Deep vein thrombosis is a sort of a block to a blood vessel called the vein inside the leg, and that can lead to leg swelling. Usually this leads to unilateral leg swelling. Unilateral meaning one leg only. Rarely it can lead to both legs being swollen or both legs having leg swelling. So DVT is another cause for leg swelling. Another etiology or cause could be medications. Some medications that are given to patients can lead to leg swelling. Now, these medications can include blood pressure medications like nifedipine, amlodipine, isolazine. These are heart medications, and there are several such other medications that can also lead to leg swelling. So, when a patient comes to us with leg swelling, we look at the various symptomatology that may be there and then get investigations or tests done to decide what the problem is. Like I already told you, if the kidney is involved, we would check the urine for protein and the blood creatinine level. We would also check a serum protein and a serum albumin level in the blood to see what is happening and then treat appropriately. If the heart is involved, we would obviously do a heart test called the echo and ECG and then look at what's happening to the heart and treat that. A liver disease is looked at by doing a liver scan called an ultrasound scan, liver function test, and further tests that may be needed as the doctor feels that it could be. With respect to DVT or deep vein thrombosis, which is a block in the blood vessel in the leg, we do what is called an ultrasound Doppler of the leg, and that will then tell us whether there is DVT in the leg causing leg swelling. If you are looking at chronic obstructive pulmonary disease, now you are looking at the lungs, so you would do a chest X-ray, if necessary a CT scan, also a pulmonary function test, and these are tests that will then show us whether there is a lung problem, and then we will do a scan of the heart to look at whether there is any right heart enlargement, and that will then tell us whether there is cor pulmonale, which is a lung disorder that leads to right heart enlargement and leg swelling. Obviously, a history will be taken on patients on what drugs they are taking, and if they are taking drugs like nifedipine and amlodipine, then we will make a check saying that, look, this could be one of the reasons why there is leg swelling. One of the appropriate treatments for leg swelling is to give a medicine which is a diuretic. It makes you pass more urine and helps get rid of the leg swelling. This is especially true and treatment for patients who have kidney and heart disease. Especially when the patient comes in with heart failure, we tend to start these medications either as tablets or injections to treat the leg swelling. But the important treatment of leg swelling would be to find the cause and manage that treatment appropriately. For example, if you are looking at improving the heart when there is congestive heart failure, then you would want to give medications to make the heart beat better, beat stronger, so that heart failure goes away and therefore the leg swelling reduces. If you are looking at DVT or deep vein thrombosis causing leg swelling, then you would want to give medicines called blood thinners or anticoagulants that will help dissolve the clot and help improve the leg swelling. So each disease process has different treatments. All in all, I would say, if you as a patient has leg swelling, then you should go to your doctor. He will test you out for the following diseases. 1, kidney disease. 2, heart disease. 3. Liver disease. 4. Lack of protein in the blood called hypoalbuminemia. 5. Lung disease. 6. He will look at your medications. 7. He may look at the veins in your leg. These are the most common causes of leg swelling, and this is something that every doctor will look at when you go and see him or her with this problem. Thank you.